was there something that triggered this, this passion that you display on a daily basis?
Well, there were any number of kind of events, but there were ones that I kind of call back on and remember. As you know, Des, I grew up in my pop's office and sweeping up and making orthotics for people, and bringing computers in there for the first time when it was super exotic in the 80s. I remember that. It was like, what is this wizardry? And now, of course, God, I would just want to rip the computers out if I were in the office now. Just get those electronic medical records out of there. But for a handwritten chart now and a real note. My God. So I may have talked to Randy about this when we chatted. If I'm not mistaken, I remember, and I was just recalling it when I think I spoke to Randy about it. And Randy, you can stop me if I'm repeating myself, but I hadn't thought about it in forever until maybe I talked about it then. But I was my first, I think it was my first day or second day as a surgical resident, and I was in Detroit. And my first day, I was working in the operating room, or Des for you, because your first name's Desmond. It sounds very British. The operating theater, to kind of translate for our folks. I was in theater, and I had just done this case with one of my mentors, this guy, Pup. What a great guy, still alive, unbelievable, hard to kill, Guy Pup. But one of my great mentors, and just a terrific, superb teacher and surgeon. And it was on, and I'm not violating HIPAA, I assure you, but it was on this a competitive basketball player, college player. And it's like 6'9" character. And I think I put a screw in this fella or lady. We'll just for HIPAA. I remember it was so testosterone inducing. It was great. But after that, and things looked great post-operatively. And then patient spent the night. And the next day I brought him over to the clinic. I wheeled him over across this frozen tundra, even in the middle of the summer. I still remember as it being frozen tundra in Detroit, and into the clinic, and to take off his cast or put him into a new one and get him out on his way. And so I did that, and I was getting him in the room. And as I was doing that, there was some delay like usual. And right next door is this little lady, because I figured I'd help in clinic. Why not? There's this lady, maybe 4'9", and she tops. And it turns out, as I'm working her up, she was there with a diabetic foot ulcer. She had just come in from India, and she had her whole family in this little room. And forgive me, by the way, I'm just remembering this all as it happens. And as I'm talking to her, I'm looking at this ulcer, this wound on her foot, and she's kind of bleeding on the floor. And I'm already thinking there's just something doesn't feel right already. And I look at her hand, and her hand is kind of burnt a little bit. And so I work her up a little more, and she had leprosy. She was in remission from leprosy as well as diabetes. So both things that cause loss of feeling. And I said, well, how'd you burn your hand? She said, oh, well, when I just got in yesterday, literally just yesterday from Chennai, I was cooking naan bread for my family. And, this is through her son who was translating. And I flipped the bread over in the oven, because I'm a baker back at home in Chennai. And so as I'm doing this, I'm trimming her wound, and she's kind of bleeding on the floor. I kind of take a step back. I go, what the heck? She like burned her fingers off. And I step back, and there's these two rooms. The one room where is this 6'9" big Adonis guy, just out of surgery, writhing in pain. A great guy, by the way, who's writhing in pain, as he should be, post-operatively. And then right next door is this little lady, maybe 4'9", bleeding on the floor after I basically just trimmed, divided her wound, and her hands burned off from baking. And I'm saying, eeny, meeny, miny, mo, we're all trained to treat pain, and we're, like we're conditioned to respond to pain. As human beings, we respond to pain and to accidents and emergencies. But what we don't respond to is the absence of it. And so I'm thinking like, wow, treating pain or treating the absence of it. No one's doing that. A lot of people are doing this. So that was my first day as a resident. And so to make a short story long, there you go, Desbel. That was it. That was the first day of the rest of my professional life.
Thank you so much for joining us for this discussion today. If you would like to learn more about our guests, head on over to our Patreon page where you can access exclusive content, including the full segment of our show. Never want to miss an Inside the Doctor's Lounge clip? Be sure to click the subscribe button to our MD Coach's YouTube channel. As always, we appreciate suggestions for future show topics. Let us know what you're thinking in the comments below. And finally, special thanks to Ryan Jones, who created and performs our theme music for the show.